This video demonstrates how to set up and use the Ballard Turbo Cleaning Closed Suction System. The Ballard Turbo Cleaning System has a catheter that retracts within an isolated turbulent cleaning chamber, which results in a cleaner catheter tip compared to a standard closed suction system. Before beginning the procedure, wash your hands and don appropriate protective equipment per your hospital protocol. Non-sterile gloves are okay. Obtain the correct catheter size. Most experts suggest that the catheter should occupy no more than half of the inner diameter of the artificial airway. To obtain the correct size, multiply the ET tube diameter by 2 and then select the next smallest catheter. For example, if you were using an 8 mm ET tube, multiply by 2 to get 16 and then choose the next catheter size down, which is 14 French. Remove the catheter from its packaging, remove the red removal wedge and attach the flex connector. If necessary, attach the catheter to the suction tubing at the thumb valve. Depress and hold the thumb valve and adjust the vacuum regulator to the desired level. Most experts suggest a negative pressure of 80 to 120 mm of mercury or -10.7 to -15.9 kilopascals. Release the thumb control valve and attach the catheter between the patient and the ventilator circuit. To begin the suctioning procedure, first stabilize the catheter and the ET tube adapter with one hand. Then, with the other hand, advance the catheter into the ET tube using your thumb and forefinger. If using a double swivel elbow catheter which has depth markings, align the printed depth number on the catheter with a similar number on the ET tube closest to the ET tube adapter. Alternatively, observe the printed number on the ET tube closest to the ET tube adapter. Now add 8 cm to this number and advance the catheter until that sum is visible in the window directly across from the irrigation port connector. At this point, the tip of the catheter will be located 1 cm past the end of the artificial airway. To begin suctioning, to press and hold the thumb valve and gently withdraw the catheter. Use intermittent or continuous suctioning technique according to your hospital protocol. It is recommended that the entire suction procedure lasts no more than 15 seconds. Stop withdrawing when you see the black ring inside of the catheter sleeve and then release the thumb valve. Now you must irrigate the catheter tip. To do this twist, open a 15 ml saline vial. Open the cap on the irrigation port and insert the saline vial intermittently to press and release the thumb valve until the catheter and chamber are clear or until the saline vial is empty. Remove the saline vial, discard it, and replace the cap on the irrigation port. Lock the thumb valve to prevent inadvertent or accidental suction. To do this, lift the white part of the thumb valve and rotate it 180 degrees. Repeat this action to unlock. Apply the appropriate day sticker to the thumb valve. As an example, if the catheter is opened on a Monday and intended to be replaced in 72 hours, place the Thursday sticker on the thumb valve. Place the suction tubing and the catheter out of the way.